Hey everybody, Dr. Hagmeyer here today, and today I want to talk about some of the things you do naturally if you're struggling with depression, anxiety, loss of focus, maybe trouble sleeping, perhaps fatigue, brain fog, or maybe even you have more serious mental health problems. Maybe you're diagnosed with schizophrenia or bipolar or generalized anxiety disorder. Maybe you're loaded up on a bunch of medications that you want to try to come off at some point in time. So in today's video, I want to talk to you specifically about some of the foods that you might be eating that are contributing to a decline in mental health. And the reason I say that is have you ever stopped or wondered for a moment if the foods that you're eating day in and day out are causing you to suffer with anxiety and depression and brain fog? At first you might think that it's not possible, that foods can't possibly cause these problems, but why not? We know that certain foods cause diabetes. We know that certain foods cause heart disease and high blood pressure. We know that certain foods cause irritable bowel syndrome and celiac disease. We know that certain foods cause autoimmune disease. We know that certain foods create and promote pain within our body. And ultimately, really, the list goes on and on and on about the connection that exists between the foods we eat and the diseases that they cause. So why is it that we don't hear more about foods and mental health? Okay, so what you eat absolutely does matter. And the foods you're eating day in and day out, the choices that you're making, every time you sit down to have a meal, every snack that you have is either causing disease, okay, building disease in your body, or reversing disease and improving health, okay? It's the bank account of health or the bank account of disease. Where are you depositing your funds, okay? And most people day in and day out are making constant deposits into the disease bank, and they're withdrawing from their health bank, okay? I'm super excited about today's video. Almost every patient that I've worked with struggles to some degree or another with anxiety and depression and brain fog and trouble sleeping. And some obviously have more advanced states than others, but all of these patients have one thing in common. They want to start finding out why they're sick. They want to start reclaiming their life. They want to do it naturally. They know that there's more that can be done for them than taking pills day in and day out. So if that's you, someone who is struggling with depression and anxiety, loss of focus, or maybe even a more advanced mental illness, in today's video you're going to learn about the foods that could be making you sick and how they're making you sick. I'm also going to show you some of the examples from patient testing that I've ran and some of the things that might be off in your body. And if you work with the right doctor, a doctor who looks at the big picture, someone who's going to be able to take all the things that we're going to talk about today and put them together, you'll be able to turn your life around and you'll be able to get your life back and you'll be able to feel good again. And the things that I'm going to talk to you about today, these are game changers for a lot of people. And I hope that they're a game changer for you. Again, these are things that I see happen every day with my patients. And there's no reason why it can't happen for you, okay? There's no reason why you can't get well. And the big thing I want you to realize is about feeling discouraged. Don't ever feel discouraged. There's always a reason. There's always a cause as to why you feel the way you do, okay? Every cause has an effect, okay? So, like many tissues of the body, your brain is incredibly sensitive to inflammation. And if we want to support your mental health, regardless again of the label of the diagnosis that a doctor may have given to you, and again, I don't care if you've been diagnosed with being schizophrenic, bipolar, general anxiety disorder, or something like brain fog, okay? We need to ask ourselves, what are some of the driving factors? What are the causes? What are the triggers behind this neuroinflammation? Because here's a matter of fact. We know that every mental health problem has, as one of its causes, is triggered and rooted in neuroinflammation. Since all health starts with our diet, in this video I want to share with you some of the things that you can do that will have a drastic impact from a dietary perspective on your mental health. So the number one thing I want to talk to you about first is gluten. Some researchers are now showing that reporting that 1 in 3 people have a gluten sensitivity. And if you've never heard of gluten, gluten is a combination of proteins that are found in wheat and rye and barley and oats and other glutinous grains. And many times when I speak with prospective patients, I'm often told things like, well, I tried a gluten-free diet and it didn't work for me. Or my doctor tested me for gluten and I don't have a problem with it, so I keep eating it. Well, let me just say for the record 2 things about these all too common statements that I hear day in and day out. Number 1, your doctor didn't test you correctly. And number 2, going on a gluten-free diet doesn't mean that you can swap out your Wonder Bread and pizza and your gluten-free bread and your bread for gluten-free bread, gluten-free beer, and gluten-free pizza. I want you to look at this illustration here, and what you're going to notice is that you have gluten at the top over here, and then you have all of these what we call subfractions of gluten. Okay, your doctor may have tested you for alpha-gliadin, and he or she may have tested you for endomysial antibodies, and they may have tested you for something called tissue transglutaminase, but these tests do not rule out gluten sensitivity. They rule out celiac disease. They do not necessarily rule out non-celiac gluten sensitivity. So in other words, every person that is diagnosed with celiac disease has a sensitivity to gluten. But just because you don't have celiac disease does not mean you don't have non-celiac gluten sensitivity. Some researchers are showing that non-celiac gluten sensitivity occurs in 1 out of every 3 people. I want you to think about the people in your family. And if you're a family of 3 or 4 people, there's a high likelihood that at least one of you has this problem. And unknowingly, some of the health problems that you're experiencing could be tied into it. Now, to rule in or rule out gluten sensitivity, the best test that you want to have done is the one that you see here. And this is a test that evaluates many of the protein subfractions that are found in a kernel of wheat or rye or barley or oats. Okay? So my question to you is this. Has your doctor tested you for gamma-gliadin? Have they tested you for omega-gliadin 17? Have they tested you for glutenin? Or have they tested you for prodinorphin? Have they looked at gluteomorphins? Have they tested you for the various transglutaminase antibodies like transglutaminase 3 or tissue transglutaminase 6? Have they looked at glutenins? Have they checked you for wheat germ agglutinin or WGA? If not, you really cannot rule out or rule in gluten sensitivity. Here's an example of a test the patient sent for my review. And when I asked what his doctor said about the test results, what he told me was that his doctor told him that he does not have a problem with gluten, and that gluten wasn't a problem, and that dietary changes have absolutely no impact on his mental health state. Notice that the only protein subfraction that was tested here was gliadin. Now here's the same patient, after watching one of my videos and reading some of the articles on my website, when he came to me and I tested him using a more sensitive and comprehensive test. Now what do you notice? I want you to look at the areas that are in the yellow and the areas in the red. Okay? What do you see here? Okay? What you see here is that he is negative for the alpha and deaminated gliadin, but what is he positive in? Okay? This person should not be eating gluten. And in fact, if you look at some of the markers here, especially in the middle of the page, gluteomorphin and the marker at the bottom of the page, tissue transglutaminase 6, when this person eats gluten, the gluten can cause problems in the brain. And specifically the areas of the brain that are the most sensitive, at least at this point in terms of what we know, is the cerebellum. And interestingly enough, the cerebellum is the area in the body, or the area of the brain, that controls balance, movement, posture, and coordination. So all of these things, balance, movement, posture, and coordination, are all influenced by the cerebellum. And when we eat gluten, especially if we have markers like this indicating that the neurological tissues are the ones that are most prone to the injury, what we're going to experience are things like ataxia. We may have restless leg syndrome. We may have numbness or tingling in our hands or on our feet. We may have migraines. We may have anxiety. Okay, the devil is in the details here, folks. And when you have a chronic problem and you're getting sicker year after year after year, you have to have the mentality, you have to have the mindset that no stone can remain unturned. Okay? It can be the difference between life and death. It could be the difference between being in a wheelchair or not being in a wheelchair. So what can we take away from this? Well, number one is we can take away that accurate testing is absolutely the first step towards an accurate diagnosis and an accurate treatment program. And without an accurate diagnosis, you can't get effective treatment. It's that simple. And I see this time and time again where people are told one thing, and had that doctor maybe been a little bit more aware of how to properly test that patient, or maybe had they dug just a little bit deeper, they would have found out about some of these things. Okay? Your chances of getting better is a whole lot harder when you don't run the right tests. Okay? So remember this. Just because you were tested for celiac disease does not rule out non-celiac gluten sensitivity. Okay? The next thing I want to talk to you about, and this is from a study that was done in 2013, and the headline of the study shows that not only does the dietary intake of wheat cause inflammation, what else does it say? It says that the dietary intake of wheat, and here's the key, it says other cereal grains and their role in inflammation. Okay? So we know that wheat causes inflammation, and we also know that other cereal grains also cause inflammation. And this is why I believe so strongly in testing for these cross-reactive grains. Now, I've written several articles and I've also done videos on some of these other cross-reactive grains and things like corn and quinoa and rice. And so if you want to go back and watch those videos, go back to my website or just in Google, just search, Dr. Hagmeyer, cross-reactive grains, type in gluten and corn, gluten, quinoa, Dr. Hagmeyer, and you'll be able to watch those videos. So the point here is I want you to know that there are other foods outside of just typically gluten, those other grains that we just talked about, that can be problematic. So outside of those glutinous grains, what else can be a driving factor for brain fog and depression and anxiety and headaches and other mental health problems? Well, the answer is there are many other different foods, and another big problem that we see time in and time out is something called casein, and this is a milk protein. This is found in milk. And here's a study that actually shows, titled Immune Activation by Casein Dietary Antigens and Bipolar Disorder. Okay? So again, casein is that protein found in milk, and this study shows what many people already know in the healthcare field. We know that in many cases, milk proteins, such as, in this study particularly casein, but whey can also cause problems. Casein can cause bipolar. So we know milk can cause mental health problems, okay? We also know that the proteins found in milk and dairy products, again, casein, whey, exorphins, and prodynorphins have a similar or overlapping amino acid sequence to gluten. And in certain individuals that eat these foods or ingest these foods will create the same immunological reaction that eating gluten can. They inflame the brain, okay? So in other words, these proteins can affect the opiate receptors of the brain the same way gluten does. And immunologists often refer to this as something known as molecular mimicry. When your body comes in contact with these foreign proteins, antibodies are formed, and these antibodies then bind to various tissues in your body. They might bind to various glands and different muscles and different organs of your body. And when this happens, this sets off an autoimmune reaction. And the studies have shown that within a 10-year period of time, people can go on to develop an autoimmune disease as a result of this molecular mimicry. Okay? This is also a reason why so many people, if they go on a gluten-free diet, and if all they do is swap out their pretzels, beer, and pizza for gluten-free variations, they never will get truly well. They may get a little bit better. They may have some, well, what often happens is they may have some of these symptoms that kind of linger, okay? These are what we call unresolved symptoms, but it's because they weren't 100%. So it's not that it didn't work, okay? You didn't do it correctly. You need to be 100% here, and that's where I focus my patients and tell them that if these markers come back, you absolutely have to be extremely diligent in minimizing exposure as best you can, okay? So what else might be causing or driving this inflammatory reaction in your brain besides gluten and milk and whey and some of these other cross-reactive cereal grains, okay? Chances are if you're struggling with depression, anxiety, brain fog, and now I want to add in symptoms of fatigue and perhaps even insomnia, changes in appetite, metabolism, another consideration from a dietary standpoint is the connection between amino acid imbalances, specifically tryptophan, and our branch chain amino acids. And this is something called the tryptophan branch chain amino acid ratio. And while this may seem very complex, and it is, I'm going to unpack the most important parts about this ratio that you need to understand. Number one is that high-carb diets are problems, okay? So who eats a high-carb diet? Well, if you're watching this and you're perhaps a vegan, or you're a vegetarian, or you just love carbohydrates, you eat lots of pasta, you're an Italian, you eat grains, you eat potatoes, you eat lots of lentils and beans, you have a sugar addiction, right? You have a sweet tooth. You're always craving. You're always fulfilling that craving with something sugary. You're drinking lots of Cokes and Pepsis and soda drinks on a daily basis. You drink alcohol. Every night you have to have a couple drinks, maybe because, who knows, whatever stress you're dealing with, the alcohol makes you forget about it and it helps you sleep and who knows what. these things are very much problematic, and these are carbs, and these carbs are sugar. Now, what I like to do with my patients that I see this kind of you know, this pattern is I like to check their insulin levels. Okay. Now, what you want to know is that you want to see insulin levels. You want to do a fasting insulin test, and what you want to see is you want to see these insulin levels less than 6.0. Anything higher than that, problem. And here's why. And here's the connection. If you have depression and brain fog and anxiety and trouble and memory with focus, I want you to pay special attention here, because high insulin decreases the amount of branched-chain amino acids into your brain. Less branched-chain amino acids into the brain means that you're flooding the brain with tryptophan, okay? And if your brain is inflamed, this is a recipe for disaster, and here's why. If you look at this illustration, once tryptophan enters the brain, it gets converted into something called serotonin or even melatonin, and that's not a problem, okay? That's actually the preferred pathway if that happens. But in cases of inflammation, what begins to happen is instead of that tryptophan going down that preferred pathway, tryptophan goes down another pathway, and this is a very important pathway. This is called the kynurenine-quinolinate pathway. And this is one of the main areas that I look for in patients who experience this anxiety, this irritability, this insomnia, this brain fog, or those who have been diagnosed with dementia and other neurodegenerative diseases. So what does this all mean? Well, as a recap, when you eat a low-protein diet, okay, a carbohydrate-rich diet full of glycemic starches and high glycemic fruits and alcohol and carbs, what you end up with is tryptophan in the brain. But because there's inflammation there, or maybe there's a stress response going on there, there's high levels of cortisol, maybe there's a bacterial dysbiotic state, maybe there's an infection, that tryptophan never gets converted into that serotonin, melatonin, and instead it goes down this other pathway and gets converted into, again, the kynurenate pathway, picolinate, quinolinic acid, all of which are markers of neuroinflammation. Inflammation within the brain. These are things we can test for, and these are things, if we see this, these are very important contributing pieces as to why you or even a loved one is suffering with mental health problems. So we talked about gluten, we talked about dairy, we talked about branched-chain amino acids and the balance between branched-chain amino acids and tryptophan. We talked about insulin levels, why we don't want those insulin levels being high. Less than 6 is where we want to see them. What else should you know about the inflammatory foods that we eat and its impact on mental health? This brings us to lectins. Okay, now lectins are known as carbohydrate binding proteins. Now I've done a video talking about some of the studies that I've read that relate lectins to rheumatoid arthritis and chronic pain. So if you want to watch that, go back and YouTube, watch that on my YouTube channel. But for the most part, these lectins are found in nuts, they're found in seeds, they're found in beans, they're found in nightshades, they're found in various receptors throughout the body. So not all lectins are bad, but again, especially if there's a problem that, from the seeds and the grasses, and maybe perhaps we see that on one of the tests we just showed you, where wheat germ agglutinin comes back being positive. This again can be a big problem for, again, those people with chronic pain and RA or rheumatoid arthritis, and people with autoimmune disease, and people that are diabetics. Okay, so what do all these diseases that I just mentioned have in common? Okay, the common denominator, time and time again, is inflammation. Okay, in this study titled "Do Dietary Lectins Cause Disease?" this study points out that several things about lectins that I believe have huge implications to people that suffer with mental health problems, especially when there's a brain-gut connection standpoint. So here's what we know about lectins from this study. Number one, lectins damage the intestinal lining by stripping away the protective mucus coat. This in turn can put you at risk for infections. It can put you at risk for bacterial overgrowth. It can damage the intestinal tissue that interferes with nutrient absorption. So you end up with all different kinds of vitamin deficiencies, and zinc deficiency, and magnesium and copper deficiencies, which ultimately also play a major role in mental health issues. We see that it disrupts the healthy gut flora. Okay, we know how important that microbiome and how important the gut flora is to the brain. The other thing is that the cells, these cells also produce the brush border enzymes. And this is incredibly important for the breakdown of sugars and starches. And so here again, this is our connection to blood sugar imbalances. Okay, lectins can cause blood sugar imbalances by causing problems to the mucosal layer of the intestines. Number two is that lectins cause a local toxic inflammatory response. When the lectin attaches to tissues in your body, this activates the immune system through what researchers call molecular mimicry. This is how researchers are linking lectins to these autoimmune diseases and things like rheumatoid arthritis and diabetes. And this is fascinating stuff because we know time and time again that the things we eat, the foods we eat, can cause problems, okay? So there is no magic diet out there for everybody, but some of these things we're talking about today are things that would be top on my priority list if I was you and I was watching this and I suffered with these problems that we are talking about through today's video. Number three is what we know about lectins is that they cause a discharge of histamine from gastric mast cells, okay? So this is incredibly important because these are the cells that not only produce histamine, but they also produce hydrochloric acid. This might lead to things like ulcers. This might be things like H. pylori infections. This might be a reason why perhaps you know you have bacterial overgrowth. Maybe you have small intestinal bacterial overgrowth, or you have small intestinal fungal overgrowth that never goes away. It gets treated with antibiotics, which again is a whole nother story. It's a whole nother video. I'm not a big fan of that. But nevertheless, it gets treated and it comes back, okay? So there's another, again, big problem there with lectins and its connection to the gastric mast cells. And again, remember, those gastric mast cells produce histamine. And so here's another reason why certain foods that we eat that are histamine producers, fermented foods like pickles and sauerkraut, maybe kombucha, maybe we're making our own kombucha or drinking kombucha, maybe we're eating a lot of barbecued or smoked foods, pickled herring and things like that. These foods can absolutely intensify the symptoms of depression and anxiety through a histamine reaction, okay? So the fourth thing we know about lectins is the impact that they have on what we call leptin resistance, okay? Now, if you're struggling with weight, leptin is a hormone made by the fat cells, and what leptin does, again, being made in the fat cells, it talks to the brain and tells the brain that you're no longer hungry, okay? So basically it's kind of like a little switch that says, okay, you're not hungry anymore, stop eating. But people that have leptin resistance, this hormonal imbalance, they will continue to gain weight, okay? They will have and struggle a lifetime with weight issues, okay? So again, another connection there between leptin resistance and lectins. The fifth thing we know is related to inflammation within the vagus nerve, okay? Now, the vagus nerve is a nerve, incredibly important nerve that we now know so much more about. I find it amazing because this is the nerve that plays a huge role in mood, okay? We know that this is a nerve that extends from the gut to the brain. And this is why a lot of people also who suffer from irritable bowel syndrome also struggle with clinical depression. And incidentally, one of the things that I find so fascinating and one thing I'm intrigued by is a study that came out that linked the vagus nerve and inflammation in that vagus nerve to Alzheimer's disease. That's right, neurodegenerative diseases like Alzheimer's disease being tied back to gut inflammation by method or by means of the vagus nerve. Okay, so we know again, the vagus nerve, inflammation, Alzheimer's disease, further contributing to the link that's being established day in and day out between the brain and the gut. Okay? What I find interesting is that of those who seek treatment for irritable bowel syndrome, studies show that between 50 to 90% have some sort of psychiatric problem, including generalized anxiety disorder and major depression. 50 to 90%, okay? So if we talk for just a moment about a leaky gut and we talk about depression, one might consider this study here, the gut-brain barrier in major depression, intestinal mucosal dysfunction. And what this all means is that these toxins that are made by bacteria in the gut are able to cause depression, okay? Another brain-gut connection. Another study shows how leaky gut is connected to autoimmune diseases. And finally, these two studies showing the connection between zonulin, which is a structural protein, and its regulation of the intestinal barrier function, the biological door to inflammation, autoimmunity, and cancer. So here again, we know a leaky gut, inflammation, autoimmunity, cancer, mental health problems. So the reason I share all of this is to show you that many people have tried a gluten-free diet, or they tried to eliminate dairy, or they tried to eliminate sugar. but it wasn't done to the degree that we've talked about today. The connections, the testing, and the understanding was missing. This is why, again, time and time and time again, you guys hear me say this, you need to work with a doctor who has the experience in functional medicine. Someone who understands these connections, someone who has the experience of tying this all together and putting it together. And unfortunately, this is something that you cannot figure out on your own. It's not something you can guess about and take this supplement or take that supplement. You have to know the mechanisms by which these problems are occurring. Without the testing, you'll never isolate where these problems are coming from. And I will say this, is that no amount of medication is going to fix this. So based on the things we talked about today, you can see why I'm so passionate about these things, because we know that they have just a huge impact on health. And all these things ultimately is the difference between you struggling and getting sicker and going from doctor to doctor to doctor over the next 10 years, or getting on the right path right away and getting back to life and living, okay? So hopefully you learned a couple of things here. This is basically, again, I think I made the case, strong enough case, why you should reconsider how some of the foods we eat promote and drive inflammation, how they cause this leaky gut, how they cause these nutritional deficiencies, how they create these imbalances between different amino acids, and how in turn identifying these things or not identifying these things can worsen your mental health problem. Again, what I find just frightening is that in this day and age, some doctors will laugh at their patients when their patient comes in and raises the topic of conversation about a leaky gut, okay? But yet, these are the same doctors who only listen to you for about 10 minutes, and within that 10-minute period of time, as they're walking out the door, they're giving you a prescription for some sort of anti-anxiety pill or sleeping pill or some sort of antidepressant or anticonvulsant or some other drug that ultimately, changes you into a zombie, okay? This mentality of healthcare needs to stop, okay? Don't let these doctors stop you from taking back your body. Don't let them stop you from taking back your brain and your future, okay? I want you to realize that a doctor who practices functional medicine will look at these things long before he or she will think about what kind of SSRI drug do you need, or what kind of anxiolytic medication do you need, or what kind of benzo do you need. So in closing today's video, I want you to realize that there are things we talked about today that ultimately only scratch the surface of some of the natural things that you can do related to your mental health. We didn't get a chance to talk about things like hormones and the role that thyroid disease plays, and how heavy metal toxicity plays a role in this. And of course, there's so much more about blood sugar imbalances and how they tie into mental health. There's so much more about how infections can tie into this. We know more and more about how infections can be related to pandas and autism. We know that methylation defects and nutritional deficiencies and other genetic SNPs like COMT all play a role in this. And this is the beauty of functional medicine. All of these things are taken into consideration. And it's those things that are going to be ultimately the difference between getting better and getting sicker. So if you enjoyed today's video, make sure you give it a big thumbs up. Make sure you subscribe to my channel. And if there's a topic that you'd be interested in hearing more about, leave us a comment below. I love reading the comments below, especially if they're good comments and they're constructive comments and they're not spam. I hate spam. I'm going to delete your spam if you spam me. But let's have a good dialogue here between those of you that are suffering with this and how much of this and the things we've talked about in today's video can have an impact. The last thing I want to say is if you have questions about becoming a patient, you can check out my website, how we work with patients that are out of state or even out of the country. And ultimately, the last thing that I want to leave you with today is don't give up, okay? Again, there's always a cause. Every effect has a cause. Your symptoms are effects. They're not the cause, okay? And once you find out where the causes are, there's absolutely no reason why you can't get better, why you can't get your life back, okay? So until next time, take care.